Hi, I'm Dr. Nidhi Agrawal, a consultant obstetrics and gynecology practicing at Cloudnine, Patparganj, East Delhi and Noida. Coming to the causes and risk factors of uterine prolapse, it would be modifiable and non-modifiable. So the modifiable risk factors are any history of chronic cough, any history of chronic long-standing constipation, or a repeated prolonged lifting of heavy weights. So these are the modifiable risk factors in which you can introduce changes. You can get your cough treated, constipation managed, you can change your occupation, or you can change the ways in which you were doing things. So these risk factors can be taken care of. What are the non-modifiable risk factors? Those are the things in your history, that you had a difficult birth, you had repeated vaginal deliveries. Those are, you cannot change it. Then in fact, we Asians, we do not have that great tensile strength, or there are patients who have some connective tissue disorders. So those patients are also prone to uterine prolapse and they cannot be modified. In fact, we have seen some patients with nulliparous prolapse. So a girl of 19 years of age and she comes with third degree uterine prolapse. She never had any pelvic surgery, never had any vaginal birth. She has a connective tissue disorder. So as she grew, the pelvic strength, the muscles and the ligaments, they grew weaker and weaker and could not contain the uterus in its position. So these are the risk factors, and the modifiable risk factors we can manage and change and reduce our risk. So talking about the treatment of uterine prolapse, treatment can be divided into conservative treatment and surgical treatment. In conservative treatment, we offer you lifestyle measures and we offer you some exercises, some do's and don'ts. And this is offered wherein patient has a first degree uterine prolapse, or where the degree of uterine prolapse is not affecting your quality of life, your day-to-day life. It is not affecting your bladder bowel functions. That's you are able to pass urine and motion easily without much effort. And the surgical part is reserved for the rest of the patients whose quality of life is getting affected. They have a third degree prolapse, they have procedentia. So there the surgery is done and there's a hysterectomy is done. But hysterectomy is not the treatment for prolapse, mind you. It is a pelvic floor repair. So we do a pelvic floor repair. It can be done with or without vaginal hysterectomy. It can be done laparoscopically, where the ligaments are all tied up to the sacrum and a complete artificial strength is given to the uterine base and the floor of the uterus, and then the uterus is again supported back. So a pelvic floor repair is needed for the surgical treatment of uterine prolapse.